This is a 30-ish-year-old female who came into the ER with sudden onset left side abdominal pain. She was found to be tachycardic, and she also reported having vaginal bleeding that was new. The ER provider, given how much pain she was and how tender she was, brought the ultrasound to the bedside and right away found the diagnosis without any pregnancy test back or any lab back. This is the transabdominal ultrasound. You can see the uterus here. This is the bladder over here, and you see all of this free fluid. In addition, from this ultrasound, you can tell that the patient is pregnant. This is your uterus here, and you can see this hyperechoic rim and this hypoechoic fluid inside, and this is the gestational sac. Now, what looks inside appears to maybe be an IUP, except the problem is it looks a little different than what we normally see, and this looks more like clotted blood. Regardless of the point, when you see this much free fluid and you find out the patient is pregnant, the next step is to move to the right upper quadrant, and that's what the provider did. And there's so much free fluid in the abdomen that you have a positive FAST exam, and you have positive free fluid in Morrison's pouch. Anytime you have someone who is pregnant, who has that much fluid in the abdomen, especially to the point where it goes into Morrison's pouch, this is ectopic pregnancy until proven otherwise. And the next step needs to be to get OBGYN to come into the ER. In this case, without having any lab work back, not knowing that the patient was pregnant, the ER provider was able to convince OB to come in, given that he had seen the gestational sac and knew that she was pregnant. And though the differential does include a ruptured ovarian cyst, this is really ectopic pregnancy until proven otherwise. You will see this finding on ultrasound about 10 times to 1 from an ectopic pregnancy to a ruptured ovarian cyst. And really the only way you can tell in this clinical setting is by opening up the abdomen and taking a look. So in this case here, the patient was expedited to the OR, and there was indeed a ruptured ectopic pregnancy. Hope this case helps. Let me know if you have any questions.